Okay, good evening. My name is Lauren Gates. I'm with Airway Health Solutions, and I love this segment because we're actually featuring an Airway Health Solutions airway dentist, Dr. Skye Zeller. So welcome, Dr. Zeller. How are you?
I'm doing great. Thanks for having me.
I love this. It just gives me a chance to see how you're doing since you attended our mini residency, and also a chance to share your experience as an airway dentist with perhaps other dentists that are curious about it, thinking about it, not quite sure if they should do it, maybe on the fence. So it's always nice to hear from someone who took our course and is walking the walk, talking the talk. So why don't you tell us just a little bit about your airway journey, like how you got started in airway?
Sure. So I actually had the benefit of working with my father-in-law, who's also a dentist. And I'd say he was on the airway train well before many other people. So when I first started joining his practice about 3.5 years ago now, he was one of the first people to constantly be like, well, did you check their tonsils and adenoids? Like, did you take a look at this? Did you do this? I, of course, brushed it off like every new dentist does.
Well, they didn't really teach that in dental school, right? It wasn't.
No, they didn't teach it. And it, you come out of dental school, you think you know everything, right? You can do a DO on number 12 and you know everything. And so I ignored him for a while. And then I decided I would sign up for my first sleep apnea class. And I loved it. I thought it was so interesting. My background is in research and medical research and biological research. And so I thought that this was a really cool way to kind of bridge everything together. And it was really on oral appliances and how do oral appliances work. And at that course, the gentleman who was teaching it mentioned Healthy Start, which is a pediatric airway treatment. And I started immediately thinking of my children, which I'm sure I'll kind of talk about a little bit. But at that point, I had to sign up for that. And so I signed up for that course. And then I heard all about Airway Health Solutions, and I listened to Dr. Moralia talk on a couple other podcasts, and I had to sign up for his. And it just became this rabbit hole where I really can't take enough courses because every time I do, I learn a little bit more. So.
Right. Oh, wonderful. Well, tell us specifically, how did Airway Health Solutions help you? I know since you've been taking a lot of courses, maybe you could just share with you what made our course unique.
It was one of the few courses that I've taken that really helped me to bridge the gap to adult expansion. I think once you start to think about airway as more than just an oral appliance, you start to think about a way to help grow people out of this problem that they've been suffering from forever. Then you can look at everything in a different way. So you start to think of things in a holistic way. And now, you start to develop a team to help treat. And I would say that it went from putting an appliance in somebody's mouth to being able to now sleep test them, refer them to wonderful ENTs in the area, refer them to an incredible myofunctional therapist to help with that part of it.
And let's give Brittany a shout out because she's part of Airway Health Solutions too. So
Absolutely.
I know you network with Brittany Sierra, who's wonderful, and a lot of our Airway Health Solutions doctors use her remotely as well.
Yeah. I have the pleasure of being only 20 minutes from her, so I get to actually use her.
I just wanted to give her a little shout out there.
Yeah. So you get to build this whole holistic team, and I think that Airway Health Solutions really preaches that. And it was really nice to see how all of those parts can come together to help a patient and grow them out of a problem that they've had forever.
And especially, I was fascinated from your research background. You really, your website, which I have posted for everybody, but you also provide research as well on your website, right? For patients or other professionals who are interested?
Yeah, so I think one of the biggest problems that we as dental professionals have when we talk to the medical community is that we don't necessarily back up what we're saying with research. So like I said, I did my PhD before I started dental school, and I have to have facts to be able to make any kind of a statement. So one of the things I try to do on my website, and I'm actually going to start doing like a live literature review as well on Facebook, is I try to go through some of the data so that it's not just me telling you, I swear this works, and like, look at these pretty pictures. There's other people who do this around the country, and we know that, yes, you can grow the maxilla, even in adults, believe it or not, after the age of 12, we can get expansion. There are changes that happen to the nasal cavity that people have showed over and over and over again. And it's nice to have the resources to be able to show that too.
Right, so that's wonderful. So why don't you go ahead and, just in case people are more auditory, going to go ahead and tell your website if they wanted to jot that down.
Yeah, it's www.dentalsleepct.com.
Okay, terrific. And share with us your most rewarding experience to date.
So I think for
Airway.
me, yeah, my most rewarding experience is really just treating my children. So my son, I have twin 6, almost 7-year-olds. I don't know how they got so old. But from the time he was about 3, we would end up in the emergency room almost once a month. He would get croup, and it would get to the point where in the middle of the night he was turning blue. And I almost felt like the ambulance knew our address and knew where to go when we called them at 2 in the morning. And it got to the point where the pediatrician was like, you know better than I do when it's time to call the ambulance. So, you know, you just do it. And it was heartbreaking to watch him be put on a ventilator, like inhaler on the way to the hospital every time. And we were actually admitted for more than one day a few times as well. And he had gone through enough as a little kid, so I did not want his tonsils and adenoids out at that point. They said that they were only mildly swollen. They said he had a floppy airway. And I didn't know. Right. Like, let's go back to data and literature and research. But yeah, that was an interesting statement. And I felt that we needed to do something. And so starting to treat him with myofunctional therapy, and that's really how I got introduced to Brittany. And then also with these appliances that Airway Health Solution really preaches, he has not had one episode of croup in the last 1.5 years.
Wow.
More than that, he's not a mouth breather anymore. So you can watch him. He used to sit on the couch, mouth open, tongue hanging low, drove me crazy. But now he never breathes through his mouth. You watch, his lips are sealed, right? His jaw growth has been unbelievable. So he has a really, really defined jawline, and everybody always makes a comment on how he looks so mature.
Wow.
And I think it's because of that. And more than that, he sleeps. And so he sleeps and I sleep, and that's a really good
well,
thing.
It's a family issue. When the children's not sleeping, it really becomes a family affair.
Yeah.
As you know. So I know you also, that was your most rewarding experience, but could you give us also a story about an adult that perhaps you helped with, or is it still too new in your process?
Yeah, so I took the residency back in October. And so I do have probably, I would say, a little over a dozen cases that I'm treating right now. And most of them are being treated with expansion appliances. But I'll say I'm the one I'm treating with just Invisalign because I know what a terrible patient I am. Given everything that you all taught me, I actually planned my own case and started doing my own expansion. And I have noticed a huge difference. So I would say within about the first 3 trays, I was starting to dream, which was crazy. I've cut down from 2 cups of coffee every morning to about half a cup of coffee in the morning. I wake up, I've always been somebody who works out in the morning, but I wake up with the energy to actually work out in the morning. So for me, that's made a huge difference. And I took a sleep test, both before and after. And, you know, I wasn't a huge snorer. And I would say for those people who know AHI and everything, my AHI was very, very borderline mild sleep apnea. And now it's all the way back to 0.5. So it's been really incredible to see the difference in myself too. Yeah.
Well, I'm so glad. And I thank you so much for taking the time to share. I know there's so much interest out there. And for anyone watching who wants to learn a little bit more, we are having an Airway Health Solutions conversation this Wednesday with Dr. Moralia about expansion and periodontal benefits. So there's a lot of confusion around that and a lot of myths out there. So hopefully we'll bust some of those on Wednesday. And hopefully, Dr. Zeller, you can join us then too, or it'll be recorded. So, okay. So I thank you so much. It's always a pleasure to hear success stories. Thank you for your time. And I'll be sure to reach out, especially if you're in the Connecticut area. Any patients listening, go get, Dr. Zeller, do you offer a consultation, or if anyone's interested in learning more, what would be their next step? Any patients out there?
Yeah, absolutely. So we offer free consultations. Generally, we like to gather a whole bunch of data on you and then come up with a plan, and we like to talk about it with you really one-on-one. Everything's personalized. And if you wanted to come on in, check out my website, www.dentalsleepct.com. Click contact us and we'll get right in touch with you.
Excellent. And you're in Wolcott, Connecticut.
Yep. Middle of the state.
Okay. Well, thanks again. It was always a pleasure, and I'll speak to you soon, I'm sure.
Thank you.
Have a great night.
You too.